Okay, well, you can sit here.
Are there any other seats, or is this the only one?
Oh, we can get you another seat if you want.
Yeah, it's fine. I'm just gonna make
Okay, that's fine. Are you good?
No, just okay.
So, Brendan, you're here today because of your sister, is that correct?
Yeah, well, she thinks there's something wrong with me, but she's really one of them.
Would you mind telling me what you mean by one of them?
You know, the people that are against me, the ones that are trying to get me down. Those guys.
So why would they be trying to put you down?
Well, obviously, they know that I'm better than them in every single way, so they're trying to take me out so they can look good.
Okay, let's move on to your childhood. What was that like?
Why do you need to know what my childhood was like? I thought you were only trying to diagnose me.
I'm just trying to get a sense of your life so I can accurately assess whether you may or may not have a disorder. Remember, this session's about you, it's not about me.
Got it. I didn't really like kids when I was growing up. I mean, others seemed too silly, and others just like to cause a lot of trouble, so I just stuck on myself.
Interesting. So you didn't have many friends then?
Interesting? What's that supposed to mean? So what if I didn't have a lot of friends? I had a few friends. What's it matter if I didn't have a lot of friends?
It's okay, Brandon, just calm down. I just need to ask you some base questions in order to accurately understand your situation. This is nothing personal. This is just to help me diagnose you.
Okay.
Okay, let's try moving on to something else. How about more recently? What have your interactions with your coworkers been like?
Okay, I swear that they are plotting something against me. Every time I enter a room, they always seem to be talking. And whenever I look at them, they stop.
Okay, what else?
Well, whenever I do talk to them, they always seem to drop these rude comments into their sentences. When I ask them about it, they get all defensive and they say they mean nothing by it, but why else would they do it?
Interesting. So I guess you would say you feel a sense of hostility coming from the other workers.
Yeah, like this one time I was walking through the office and this woman bumped into me and then pretended that she didn't do it. After that, I gave her a piece of my mind. She gets up all in my business and keeps repeating that she didn't do anything. Needless to say, I haven't forgiven her for that day.
Okay, so Brendan, have you ever heard of PPD?
No, what does that mean?
It means paranoid personality disorder. Essentially, it causes you to have a severe distrust of the people around you, ranging from your co-workers to your family members.
You think I have this? What makes you so sure?
Well, there's this test we can conduct based upon your behavior. It has several different categories, and if you fulfill 4 of those categories, then we can prove that you have paranoid personality disorder.
I think I want to see this list.
Okay. As you can see, as we went through the entire session, you basically showed all these traits.
So even if I did have this disorder, what would make you think I had it?
Well, it says here that your mother's side of the family has a history of chronic schizophrenia, which already puts you at an increased risk for PPD. Were your parents very close to you?
No, they hated me just as much as the rest. Always punished me for every tiny detail and clearly loved my sister more than me.
I see. That's another leading cause of PPD, when the parents are both distant and loving towards a child.
So let's say for a second that you are telling the truth, and I do have this disorder. Is there any cure for it as of now?
No, paranoid personality disorder is something you're going to have to live with the rest of your life. However, we can manage it using
No medication! I want to know what's going in my body, and anything in the form of a pill could easily cause damage without me knowing.
Okay then, that's a relatively normal response for someone in your position. How would you feel about psychotherapy?
Isn't that the thing where I sit in a chair and talk about my mother?
Sort of. Psychotherapy is when you sit down with a professional and you talk about your mood, your thoughts, and your behavior. It's designed to make you expose your fears and then have them disproven, allowing for you to become more relaxed in the presence of others.
So, you think if I came back again, I'd have you for another session?
Yes, Brandon, I'd love to have you back for another session.
I'd like that very much.
Okay. Well, Brandon, it's been a pleasure having you here today.
You too.